Thank you, Mr. Speaker. Just before the holidays, I had pressed the PM to follow through on a critical election promise, funding a new $4.5 billion mental health transfer to the provinces and the territories, the Canada Mental Health Transfer. At the time, I'd pushed for it to be in Budget 2023. This echoed the call of 65 organizations across the country similarly calling for the acceleration of the implementation of this transfer and for it to be in Budget 2023. This includes the Canadian Mental Health Association, the Canadian Association of Community Health Centres, the Canadian Psychological Association, the Canadian Federation of Students, the Alzheimer's Society, the Canadian Centre for Policy Alternatives. The list goes on. And so I appreciate the chance to come back to this question because at the time, the question wasn't answered and I haven't had clarification since. 2 points I'd like to leave the Parliamentary Secretary with for her to comment on. First, the mental health is health, and so it deserves dedicated funding. Mental illnesses and substance use disorders will affect 1 in 3 people in their lifetime, and we know that the pandemic has only made this worse. Of these folks, 1 in 3 can't get the care that they need. This adds up to almost 4,000 people in my community waiting for mental health and addictions care. I've had the chance to speak with some of these folks myself. Last summer, speaking with a mom on her doorstep in tears, describing her teenage daughter and the mental health challenges she was facing. Or when I spoke with a nurse this past summer who told me about the number of people that she's seeing at Grand River Hospital's emergency department who should have seen a psychiatrist or a mental health professional months before. It's all why dedicated funding for mental health is so important, is that it also, of course, takes pressure off other areas in our healthcare system. Takes pressure off emergency departments, off doctors, off social services, and of course off the millions of people who are suffering. It's of course why the 65 organizations I mentioned earlier are pushing for this promise to be followed through on. Which is then my second point, that election promises matter. That from the Liberals' 2021 campaign platform, I'll read it myself, it was in red, a comprehensive plan for mental health care across Canada. The plan went on to say that they would commit to permanent, ongoing funding for mental health services under the Canada Mental Health Transfer. So, Mr. Speaker, call me radical, but I believe it's important that political parties and their leaders follow through on promises that they make. I think it's important for our democracy that this is the case, and for our Parliament to keep them accountable to it. Now, I expect the Parliamentary Secretary will make mention of an important announcement made just yesterday on healthcare. I've read the announcement multiple times, but as I parse through it, there's no mention of the mental health transfer specifically, and nothing specifically about dedicated funds for mental health. And so my question for the Parliamentary Secretary tonight is if she can make clear whether the governing party is continuing to be committed to the Canada Mental Health Transfer and whether it will be included, this $4.5 billion, in Budget 2023. Thank you.
L'honorable Secrétaire parlementaire.
Thank you, Mr. Speaker. And as my colleague said, there is no health without mental health. That is why access to mental health and substance use supports, including at the community level, is a fundamental piece of work we want to undertake with the provinces and territories.
I think that we all recognize that our healthcare system is facing significant challenges that are made worse by the pandemic. We are working with the provinces to recover, and we must ensure that mental health and addictions care be integrated transparently as an integral and equal part of our universal healthcare system.
The proposal we put forward to the premiers yesterday provides both the resources and the mechanism to get us there. Nous respectons notre engagement de
We respect our commitment to transfer billions of dollars to the provinces and territories over the next years in order to support mental health, but we will do so by increasing the Canada Health Transfer, which includes mental health, and by transferring $25 billion over 10 years under integrated long-term bilateral agreements. During the working meeting with provincial premiers, the federal government announced that it will increase health funding for the provinces and territories by $196.1 billion over 10 years, including $46.2 billion in new funding. That funding includes an immediate, no-strings-attached increase of $2 billion under the Canada Health Transfers in order to respond to immediate pressures on the healthcare system, as well as a guarantee of 5% increase to the transfers over the next 5 years with annual complementary payments, if needed, which will provide additional support totaling $17.3 billion over 10 years. And the final transfer will be integrated to the transfer at the end of the 5 years in order to offer a permanent increase to funding, which will give predictability and sustainability to the provinces. Thanks to this guarantee, the health transfer will increase by 33% over 5 years and 61% over 10 years.
We are also providing $25 billion over 10 years to advance shared health priorities through tailored bilateral agreements that will support the needs of people in each province and territory in 4 areas of shared priority: family health services, health workers and backlogs, mental health and substance use, and modernized health system. We believe these bilateral agreements are the most effective way to incorporate shared priorities into this funding, reflect the unique needs of each province and territory, and to support mental health as part of an integrated, patient-centered approach. The goal of this collaborative work and these bilateral agreements is to provide Canadians with a multidisciplinary system of care. Une approche qui intègre la
An approach that integrates mental health into all joint priorities, whether by increasing access to mental health through primary care or improving data sharing and health data sharing between consulted professionals, or an approach to improve the labor shortage in the area of health and mental health and provide better support in order to avoid burnout.
These are results that will improve access to the support Canadians need when they need it.
For Kitchener Centre.
Thank you, Mr. Speaker. I think there's a really important question for the Parliamentary Secretary to clarify in response, because I would agree with her. The announcement made yesterday is an important one for healthcare, but it is not what was committed in the 2021 election campaign. Specifically, what I'd like to understand better is that there was a promise and a commitment for dedicated mental health funds. It was to be called the Canada Mental Health Transfer. Yesterday, as the Parliamentary Secretary has shared, new dollars have been set aside for healthcare, which is good. But we need dedicated funds for mental health, as the governing party has promised and ran an entire election campaign on, which they won. And so my question remains that is the governing party still committed to the mental health transfer? And if so, will it be in budget 2023?
L'honorable député de Sherbrooke.
Thank you, Mr. Speaker. The significant increases to the Canada Health Transfer will give the provinces and territories essential resources to support health care, including mental health care. The additional $25 billion for tailor-made agreements with provinces and territories will also help expand the delivery of timely, high-quality, integrated, and accessible mental health and substance use services in Canada. Through the proposed bilateral, we will be working to integrate mental health and substance use care priorities as a full and equal part of our universal healthcare system. Cela va assurer
That will ensure transparency and accountability from provinces and territories in regards to access to mental health and addiction services. We will build on the $5 billion over 10 years that we are currently providing for mental health support and that we have been providing since 2017, which currently transfers $600 million annually to provinces and territories until 2027.